Welcome to Signs and Symptoms of Illnesses. I'm doing this training as a result of the audit. All our employees need to have this training course. And so for those visual learners, I thought this might be the best way to do this training. All right, so the purpose of the training is to help client care staff to identify, respond, and document the symptoms of illnesses of any Avery's Village's young male clients. So what we're going to look at, our objectives are symptoms of illnesses, exploring illnesses, prevention of illnesses and medical emergencies, and documentation. So these 5 things. So this training is going to help you recognize when an individual may be ill. So when you're on the job, please be on the alert to use your senses of sight, hearing, touch, and smell to identify the symptoms of illnesses. So the top 3 symptoms in early educational settings for illnesses is respiratory, which is 66% in this particular study, fever, 14%, and gastrointestinal, which is related to vomiting and diarrhea. So other symptoms include cough, rash, runny nose, congestion, aches and pains, mouth sores, and swollen glands. So these are the things that we need to be on the lookout for. Again, the 3 symptoms, the top ones are respiratory, fever, and gastrointestinal. So when you talk about the spread of illnesses, respiratory transmission is when a communicable disease germ passes from the lungs, the throat, and nose of one person to another. And that can be accomplished by sneezing, coughing, and secretions. So some common illnesses are influenza, which is the flu, cold, chicken pox, and something as serious as tuberculosis can be transmitted through the respiratory. Another respiratory transmitted, we already talked about these 2, but we'll look at it a little deeper, is the flu and common cold are both respiratory illnesses with similar symptoms. So it's kind of hard to distinguish between the 2, but in general, the flu is intense and the cold is milder. So some key symptoms for the flu are body aches, fevers and chills, fatigue, and headaches. Another respiratory transmission would be a sore throat. And a sore throat is generally caused by a virus. So that's the key distinction between a sore throat and a strep throat. A sore throat is caused by a virus, and it'll clear up on its own. You can treat it by salt water and gargling, while a strep throat is caused by bacteria, and it needs to be treated with a doctor visit, usually treated by antibiotics. And the symptoms for the strep throat are there white spots in the back of the throat or a gray furry tongue. And finally, the last respiratory transmission that we're looking at here is the norovirus. And the norovirus is caused by human waste. So episodes of vomit and diarrhea, they can shed billions of aerosolized droplets that are highly contagious particles. So they're traveling through the air. Now this is the important thing to remember. These are really contagious. So that a pinhead size of the norovirus, or particles of the norovirus, can infect more than 1,000 people. It only takes 18 of those little particles that are too small to see with the human eye to make a person sick. The next series of transmitted diseases are contact transmission. And so we have illnesses that can be transmitted by direct contact, and these are some examples, and we're going to look at some pictures of these. Impetigo, ringworm, pink eye, head lice, and chickenpox. And so impetigo is a common and highly contagious skin infection that mainly affects children. So a common place that appears is on the face. And then you have the ringworm, which is a common fungal skin infection, otherwise known as you can pronounce it tinea, in the shape of a ring. And so it can have variations that look like this. Next is pink eye, and it's an infection of the eye, usually caused by a bacteria or virus that results in red, itchy, painful. And then another one contact is head lice, and these are tiny insects that live on the skin covering the top of your head, feeding on human blood. So here in this picture you have a magnified version of head lice, which is an actual insect-type creature. But then you can see these little eggs. So in the treatment of those, you have to address those eggs as well. And finally, in our contact transmission, we have chickenpox, an infection caused by a virus that is highly contagious and causes itchy rash with small fluid-filled blisters. Now, the biggest prevention method that you can use is the #1 prevention method of all these illnesses is washing your hands. So here are the steps. You've heard them over and over again, but you've got to practice these frequently throughout the day. Wet your hands, soap your hands, and then lather and scrub for 20 seconds. Now you can sing the alphabet song, that's about 20 seconds. And you want to make sure as you do that you get the back of your hands as you're scrubbing and lathering, and then also your fingernails. Then rinse for 10 seconds. Turn off the tap water. Usually you want to get the towel. I think these two steps probably could be reversed. You can get the towel, dry your hands. All right, so, and these pictures are related to between your fingers, under your nails, and the top of your hands. All right, and also another preventive measure is cleaning, right? Cleaning is a mechanical process of scrubbing with soap, detergent, and water to remove dirt, debris, and many germs. Sanitizing is a chemical process of reducing the number of disease-causing germs on clean surface to a safe level. And then disinfecting is a chemical process that uses specific products to destroy harmful germs on a surface. Okay, medical emergencies. 3 things you can do here. 911, medical emergencies that require immediate medical attention. Urgent doctor visit. Call or visit the doctor when potentially serious symptoms arise. And then routine treatment. These are symptoms treated by simple first aid or with a written doctor's order. So when to call 911, you don't want to second guess yourself. If you're thinking about doing, go ahead. We want to err on the side of caution. But here's some ideals for when you should call 911: uncontrolled bleeding, client's unconscious, no pulse, breathing problems, chest pain, serious injuries, shock, long-lasting seizure, and that's more than 5 minutes, electrical shock, near drowning, severe burns. Now, if a client, a client is poisoned, the first call that you should make is actually to the Poison Control Center. You call them first to get advice and then call 911. So when to call a doctor? The onset of a fever. It's 101 degrees, that's a fever, or higher. And we have at our facility a forehead thermometer that you just swipe across your forehead to get the temperature. We also have a blood pressure machine. But you might also call the doctor or visit the doctor when there's diarrhea or vomiting lasting more than 4 hours, a rash lasting several days or getting worse, increasing seizure activity, signs of infection, or any other serious symptoms or injuries. Now, when you do call the doctor, it is important in our facility to document using the TC03 incident form. So you want to inform your supervisor, #1, you want to take an action, and then next you want to fill out completely that form with specific step-by-step details of who, what, when, why, and how. And that's also important in the actions you take, that you're writing those things down. And then contact the caseworker, the client's caseworker, and the CPA within an hour. And then you want to email that incident form within 12 hours to the caseworker and the CPA. So that concludes the training.